As daily living costs and minimum wage become increasingly central topics of discussion, questions around public health also arise. Time and time again, we've seen that financial difficulties can hinder access to essential medications, often leading to worsened health outcomes and complications. But what about housing instability and its relationship to chronic conditions like type 2 diabetes? This was the central question of a recent study published in JAMA in 2025. The study, a retrospective cohort analysis, used data from US community-based health centers spanning June 2016 to April 2023. It included 90,233 adults and compared health outcomes between individuals experiencing housing instability and those with stable housing. Researchers also adjusted for demographic variables such as age, race, and sex. They measured outcomes using hemoglobin A1C, a 3-month average of blood sugar, blood pressure, and cholesterol levels at multiple time points: 6, 18, 24, 30, and 36 months. As expected, there was a statistically significant difference in health outcomes between the two groups. Interestingly, while the differences in cholesterol and blood pressure were only statistically significant up to 24 months, the disparity in A1C levels persisted across all time points. This suggests that housing instability may have a particularly enduring impact on blood sugar control in individuals with type 2 diabetes. Of course, there are limitations to this study, the most prominent being that it is observational and correlation does not imply causation. Nevertheless, these findings provide a compelling data point in broader conversations about rising homelessness, food insecurity, increasing rent and housing prices, and the growing trend of corporate ownership of residential properties.